Hi, my name is Katia Guzman, and I did my disease report on Group A Streptococcus. Now, before I start and go any further, I'm going to need y'all to strep yourselves in because we're about to go on an educational trip and learn all about strep. Now, our first stop is going to be here with the history. So the first description of streptococcal infection is attributed to the Austrian surgeon Theodor Billroth in 1874. Here we have that man here. Now, the first time he saw these organisms, he described them as either isolated or arranged in pairs, sometimes in chains of 4 to 20 or more links. And so skip forward a couple years, but like 5 years, we have Louis Pasteur here. And he isolated the microorganisms from the uterus and the blood of women with puerperal fever. Now, back then, it was high mortality rates between the women and the newborns at that time. So we skip over a little bit back a couple years, 1842, we have Dr. Semmelweis right there. He is a Hungarian physician who worked in wards. He noticed, he observed the mortality rates between the different clinics there. He noticed that the mortality rates in one clinic was higher than the other. He wanted to come down to why. Why was this happening? He conducted a research. He observed the physicians and medical students in Clinic 1. He noticed that their first stop in the morning would be the autopsy rooms and noticed that they would not wash their hands from going to the autopsy room to see their patients. So they were literally physically carrying that bacteria from those corpses that they dealt with to the patients that they would see afterwards. And so in 1847, after he came to the conclusion of what was happening, he ordered all medical attendants to scrub their hands in chlorinated lime solution. After months, the mortality rate went down from 11% to 2%. So thanks to him, our doctors washed their hands. All right, and we're going to see a couple of the things. So a little bit more history. So back then, scarlet fever also had very high mortality rates. So in 1920s, George and Gladys Disick showed that the scarlet fever was associated to the sore throat. This was the first time that they linked the two together. And so this was so contagious back then and such high mortality rate that they would post these quarantine scarlet fevers in the homes of the deceased individuals to isolate the patient and prevent further spread of this disease. And yes, it was penalized by law if you were to come in contact with them after seeing this slip. Okay, we're going to see, so now we're going to talk about what exactly is Group A Streptococcus. I'm going to move myself a little bit. Now, this is a question where I'm going to answer today. These are questions the doctors asked themselves back then. What was causing these deaths? They wanted to know, get down to the bone. So it is a gram-positive extracellular bacterial pathogen. It is aerotolerant. It is made of non-motile and non-sporing cocci. It is a round bacteria. It is beta hemolytic. We'll talk about why that's important later. The name is derived from the Greek words meaning chain, strepto, of berries, coccus, pio, pus, and forming genes. And so it is very sensitive to drying, heat, and disinfectant. So wash your hands, dry maybe with that little heat dryer. And it inhibits mainly the throat, the nasopharynx, and occasionally the skin if it goes untreated. Okay, now we're going to see what happens. What does it cause? So one of the most common causes is strep throat. Before we go in a little bit into that, I'm going to mention that there was an estimated 700 million infections caused by Group A Streptococcus. Now, the mortality rate for those infections was 0.1%, but so out of that, over 650,000 cases were severe and invasive, and the mortality rate of those 650,000 cases was 25%. So get yourself treated. Do not let it get to that point. You do not want to have a 25% chance of dying. That would not be fun, I could imagine. So let's go back a little bit to that sore throat. It is the infection of the back of the throat, including the tonsils here. You can see that pus, pyro. Going back to that Greek, the pus. And then our second one that we're going to view here is impetigo. It is more common in children than in adults. It is highly contagious. It's easily spread from person to person by direct contact with the lesions and or indirectly touching items that have come into contact with those lesions. Be careful. If you know anybody that has it, stay away, wash your hands, don't even look at them. Just kidding. And then here we have the erysipelas. This is the last one we're talking about on this slide. It is infection involving the superficial lymphatics. The skin is red and swollen. You can see that here. It can occur on any part of the skin. Do not be. And then including the face, we have your arms, fingers, legs, and toes. It does favor extremities. Fat tissue, facial areas around the eyes, ears, and cheeks are the most common due to those like entryways. And so next we're going to talk about what happens if you go untreated. Do not go untreated. You do not want to die. Go get checked. Okay, so occasionally the bacteria will make it past normal defense of the body. If the bacteria remains untreated, it will enter the blood and other tissues of the body. You do not want to be this lady here. This is not attractive. Leave that for Halloween. And so the first one, it gets a little bit more interesting. So this is our flesh-eating bacteria. So this is when it gets into places where bacteria does not normally live. It becomes invasive strep infection. So it refers to the condition. It occurs in the tissues under the skin. It affects the fat, that fascia, and the muscles. The tissue can quickly. So the tissues that is affected can quickly die due to poor blood supply, and it will possibly lead to your death. So get yourself checked. The bacteria will destroy soft tissues at this subcutaneous level and is often coupled with toxic shock syndrome. They are both very deadly, so put together, they are extra deadly. If the muscle is destroyed, it's going to look like this woman here. You do not want that. It's not cute. Okay, another thing that it can cause is a rheumatic fever. Now, this is a delayed consequence of an untreated upper respiratory system. It causes serious debilitating damage to the heart. Now, if this fever goes untreated, it can lead to rheumatic heart disease. And that is the most cause of permanent heart valve damage in children. And next, we're going to talk about the scarlet fever rash. Now, scarlet fever did have a high mortality rate back in the days. We do have medicine for that too, but it is still not fun to get. You look like this. Not cute. And so we're going to talk about a little bit of the symptoms. I'm going to go in a little bit more in depth of what comes along with this beautiful rash. Remove myself a little bit there. So first, we're going to talk about the symptoms of strep throat. So you have a pretty bad sore throat. You get painful swallowing, a low-grade fever, maybe have some GI symptoms. You get nausea, vomiting. I'm sorry. Now, the biggest thing to look for is that absence of a cough, because it allows for doctors to rule out any other diseases such as bronchitis, laryngitis. And then we have your impetigo. We saw that picture earlier. So it involves red sores that quickly rupture. That is what is contagious when you come into contact with those ruptured sores. To stay away from them. The sores usually occur around the nose and the mouth and can be spread of other areas. Fingers, clothing and towels, itching and soreness are generally the cause of the spreading. Okay, and then we're going to go to our less. That was also a picture. So it develops symptoms such as fever, shaking, chills, fatigue, headaches, vomiting. General illness comes within 48 hours of infection. Well, once it gets bad. Then we're going to go to our flesh-eating disease. And so some of the symptoms with that come with it are fever, nausea, vomiting, and other flu-like symptoms are common. So if you had that sore throat earlier and now you're feeling kind of feverish, fluish, go get yourself checked, because you do not want half of your face missing. Okay, and so now we're going to talk about the scarlet fever. Now, some of the things that come with our friend the scarlet fever, so some of the things that they were seeing back then are red streaks in the folds of the skin where the skin creases, rash that forms red lines, areas usually around the armpits, elbows, necks, and groin. We have a red face is also very common. We have, and the strawberry tongue. So your tongue looks like a strawberry. Although strawberries may be yummy, it's not fun for your tongue to look like a strawberry. No. And then, so some of the symptoms that come along with the fever, the rheumatic fever here. This one comes with painful and tender joints, most often the knees and ankles, red or hot swollen joints, small painless bumps beneath the skin. You get yourself some chest pain there, fatigue, jerky and controllable body movements. And then with the scarlet fever, we have that we have very similar symptoms as well for that one. And then we're going to go into a little bit of methods of transmission. So we have the respiratory droplets, we have hand contact, so direct contact with those lesions can be found in carrier states, these listed right here, and can also spread from cattle to humans through raw milk. So get your milk pasteurized, very easy to do so. And so S. pyrogenes, which is also short for Streptococcus, group A, has several factors that enable it to attach to its host. It invades the immune response and spread by penetrating the tissues. And now we're going to go to how do you identify whether you have strep. So usually what they do, you go to the doctor, they swab your throat. They come back in a matter of minutes, tell you if you are, if you do have strep. If you do, get on that antibiotics as soon as possible. You don't want it to get bad. You don't want it to get, you don't want to become that have a 25% chance of dying. So you can also tell with your symptoms. The doctor or physician you're seeing will usually know whether you have strep throat or not. And now we're going to go to vaccines and treatments. There are currently no vaccines. The treatment can be penicillin or amoxicillin, and the men, the elderly, and the children are at higher risk. I'd be glad to answer any questions more about these treatments and why they work. But a quick note has to do with the penicillin. So penicillin does fail to treat severe invasive streptococcal infections because the stationary phase happens very quickly, and penicillin is not very effective to that once it reaches that stationary phase. But I will be glad to answer more questions about that during the panel. And last but not least, we have my Works Cited page. I'm so sorry about that, and thank you.